Someone else who knows firsthand what it's like to fight this virus with a member of her own family, and she's a member of our NBC family, Kate Snow, our senior national correspondent. Her husband has been ill with COVID since April 2nd and is isolating in their basement. And Kate joins us now to share her advice and talk to us about how she's dealing with it. Good morning to you, Kate.
Hey, good morning, Sheinelle. It's so good to see you.
Good to see you, too, even if it's this way. Let's dig in here and talk about, I guess it's been nearly 2 weeks since Chris started feeling unwell. How is he doing this morning?
Yes. So the good news, like the family that we just interviewed, we are so lucky. I feel so blessed that he is feeling much, much better. A lot of people don't ever go to the hospital. He never had to go to the hospital. He did get a test. I think we have a little video of him driving up on Saturday to get a test for coronavirus. When he finally felt well enough to drive, that's when he could finally go. It took 3 days to get an appointment here in New York State. They took the swabs. We're waiting for those results right now. Sheinelle, we don't have them yet. So we're presuming he has coronavirus, but we're not actually, haven't confirmed it just yet.
Let's get into what you've learned. One of the first things we're told is to monitor your oxygen levels. So I know you monitor Chris's blood oxygen levels. How are you doing that? And can you talk for a moment about why that's so important?
Yeah, so my doctor, our primary care physician, the first time I called her, which is over a week ago on a Friday morning, to say all his symptoms, he had massive body aches, he was coughing and having some trouble breathing. She said, get an app. Can you believe there's an app for that? So it's called Oximeter. I can't endorse it, but it's the one my doctor recommended, right? So you push start and you cover your phone. If you can see the video here, you cover your phone with your finger like that. You cover the camera and the flash, and it takes your reading on the screen of your blood oxygen level, which should be usually like 99, 100. I'm not a doctor, but that's what I've been told. If it starts to dip low and you want to ask your own doctor what low means for you, that's where you get in trouble. And my doctor said, if it dips below a certain number, I want you to take him to the ER. And I checked it like every 3 hours.
I think we can help a lot of people this morning. We've seen the pulse ox that you can buy, but I didn't realize you can buy this one. There's another little device I see on your table there.
Right. This kind of thing you can buy at a drugstore, but right now, Sheinelle, they're not available. So this app was a lifesaver for us.
Wow. So he's also been using is it a spirometer? Is that what that is on the table there?
Yeah. I didn't even know what the heck a spirometer was. My sister-in-law, his sister, Courtney, is a nurse, and she said, get a spirometer. And I was like, what's that? It's sort of like a game that you use to help your lungs. You use to exercise your lungs. It's got incentive. So you suck air. Okay, I'm going to show you. And you try to get this piston to rise. Watch. So you're exercising your lungs and doing the deepest breath you can and trying to get this to go as high as you can. People often get these after surgery. This one is my mom's because she had surgery and she had this thing in the house and she sent it to me. Chris has his own downstairs. Don't worry, I'm not using his. But it's been, even for me, it feels good to kind of do this. Now, I'm told by our medical unit that you should talk to your doctor because this is good for people like who don't have massive problems. But like the woman you were just talking to who was on a ventilator, I don't think you'd want to use this if you're having trouble breathing. But again, ask your own physician about it. It's just a tool that we found that Chris is finding really helpful.
I was sitting there, I'm listening to you talk. I know you have kids. You keep the family together. I can't imagine your cleaning routine right now because I'm sure you're trying to keep yourself healthy, everybody else healthy. What's your routine?
Yeah, so I'm not perfect, but I do have this mop behind me. You see that? So Clorox. I'm sorry, I shouldn't mention a brand name. Bleach. You can take a third cup of bleach and mix it with a gallon of water. That's per the CDC. So the CDC recommends a third cup of bleach, a gallon of water. You see me doing it there. I took some video the other day. Wipe down every surface that is, like a countertop, a table, not wood because the bleach would stain it, but things that you can safely bleach, and that will disinfect. The CDC says that will kill the coronavirus. So I have been a mad woman, Sheinelle, wiping down surfaces and, leave it on there for like a minute so that it dries. That's what the CDC says. So then that's what really the bleach has to kind of air dry, and that's what kills the virus.
Well, Kate, thank you. Good advice. I wish you all the best. And tell your husband we wish him the best, too, in his recovery. And I hope
Thank you.
to
We're
see you
doing so
again
much
soon,
better.
physically.
Yeah,
Thank you,
me too.
Kate.
I'm on quarantine until
All right.
Friday.
We'll be right back.